Hi, so I'm Jodian Barrett. So I'm currently the digital lead nurse for the Care Information Exchange, which is our patient portal, and also the lead nurse for our remote patient monitoring hub, which covers all of patients within Northwest London. Within my current role, so we use the clinical informatics quite a lot, especially within the remote patient monitoring and the patient portal. So within the remote patient monitoring, we build the forms that are completed for the virtual reviews or for the virtual wards or for the remote monitoring aspects of it. So we do both virtual wards and remote monitoring. And with those, what we do is when the nurses review the patients, they complete what we call power forms within our EPR system. But the EPR system power forms, they're built so that they capture data so that we're able to run audits specific. So for example, if we wanted to know how many heart failure patients had blood pressures above like I don't know 180 um systolic blood pressures above 180, or if we wanted to know how many of them had moderate to severe chest pains, then because of how the forms have been built, we're able to actually run a report and go down to the different go down specifically to via either the institution that the patient's admitted under or via the team that they're under. The information that we get from the virtual wards and from the remote monitoring, what it allows for us to do, it allows for us to identify the areas that we need to improve in terms of service provision. So, for example, some of the feedback that we've had from patients as well as so patients provide us with feedback in terms of like the remote monitoring platforms that we use or for example with the patient portal, which then drives the changes that we create as a result. So the patient involvement aspect of it is really important, but then we also use the data to back up the information that the patients are saying. So for example, we had patients who were expressing that they were having difficulties in capturing some of the symptoms within some of the platforms that we were using. So as a result of that, we were then able to change the platform slightly, and then the data that started to be produced as part of that was then a lot better. So from the start of setting up a pathway, we have like the data as like the means of driving information and driving care and providing the best service, I suppose, for the patient. So what we do is before the pathway even goes live, we create the forms that we complete as the clinical nursing team. But the forms are created in conjunction with the specialist services so that we capture the right data from the patients, be it through whether a platform or over the telephone. And then we use that data to help drive changes within the services. So within COPD, for example, if you wanted to see how many patients had SBARs done, then we're able to actually use the data from the SBARs that we complete whilst monitoring the patients, or we're able to say, for example, how many patients who were within the virtual wards had across any of the acute sites or within the community had exacerbations of their COPD and required increased use of their nebulizers, for instance. So we'd have the data that's be able to provide that in an instant via our business intelligence teams, or you can pull a report as well. In terms of my projects that I'm currently working on, so I'm currently actually on secondment with the ICB, and I'm doing alignment works across the sector to align the virtual ward pathways, so helping to align the SOPs and in terms of the benefits realization and how we can use the data that's provided from the virtual wards and remote monitoring to help support the cases for the virtual wards. In the last year, we've seen a significant increase across the virtual wards and the remote monitoring pathways. It's been really good. I've enjoyed the secondment with the ICB. It has allowed me to see how the system feeds into like the remote monitoring hub that I run. And it's been nice to have that continuity between what we do in terms of the day-to-day versus how we get to the day-to-day management, and then how we then use the data that's captured as part of the remote monitoring so that we can drive changes to better facilitate and to help educate the patients. So there's a lot of patient education as part of the virtual wards and remote monitoring. And then in terms of with the patient portal, again, this is kind of fed into that because it's helped us to identify again how the data that we that the patients have can be used to help them to educate themselves on their conditions and just to have a better health and well-being. So that's been really good. So how did I hear about the FCI? Well, so I actually heard about it from a previous colleague in my previous trust, where he was encouraging both myself and one of our other colleagues to sign up. So when I then came into this role again, so my manager is a fellow within the faculty, and he was like, well, it's a good thing to apply for and to do. So he was encouraging, and I actually had support in terms of completing the application within my team, which was very helpful. So that's how I heard of the faculty. Okay, so what advice would I give to someone who's trying to get into my role or a role similar to this? So coming from being a pediatric nurse, working on the wards and just working in nursing in general, I think there are times where we're told that we can only be what the preconceived notion of a nurse is, and actually a nurse can be anything that they want to be, or like we can be anything that we want to be. It's just, so someone once said to me, oh, like, what's your next role? And I was like, well, this job that I'm in now didn't exist before I was in it. So my next job might not exist, and it's the same for them. So my advice to someone else would be, if you see something and you like the look of it, check the JD and look for all the things that you can do. The bits that you can't do, research it, talk to the people who are offering the job, and just go for it. The worst you can get is no.